Hi, this is Dr. Bob Danoff, the Public Health Officer of Douglas County, with another of our COVID conversations. And we're talking more stuff today. We have with us today Laura Turpin, who is one of our epidemiologists. And we'll talk a little bit later about something that we haven't heard much about in the world, syphilis, but something which has been a real public health issue over the last little bit. But still, COVID is in the spotlight. COVID is clearly not gone, but the number of cases in the world is about steady. There is a little bit of a hotspot in Europe and a little bit of a hotspot in South America. And this worries us a little bit because as we are coming now to our summer, they're coming to their winter. And we're starting to see with the winter time and the cooler temperatures in South America that they're starting to have something of an increase. The good news is South Africa has not seen a big increase. Australia and New Zealand, also in the Southern Hemisphere, have had high number of cases over the last 6 months, but actually they're coming down. So the worry is that comes the fall and the winter, when people start to gather more indoors, that the number of cases will go up. So we're going to carefully be following what's happening in the Southern Hemisphere. The other reason we carefully follow the Southern Hemisphere is because the flu that comes around each year typically starts in the Southern Hemisphere and then moves to the Northern Hemisphere. So we're also going to look to see what's happening with their flu seasons. In the U.S., cases are about flat. There are no real hotspots in the U.S., although Southern Florida and Puerto Rico continue to have a high number of cases. In Oregon, we are about steady, slightly up in the last 2 weeks, but hospitalizations remain low and deaths remain very low. So that's all good news. In Douglas County, we're seeing a moderate number of cases, still in that 20 to 30 cases per day range. We have about a dozen hospitalizations. The thing that's important about the hospitalizations is that very few of these people are sick with respiratory illness. So many of these are older people who have gastrointestinal or other reasons they're in the hospital. When I looked the other day, only 3 of the 12 were on oxygen. And so that the risk of that the hospital is clearly not nearly as crowded as it was back either during the Delta phase or during the Omicron phase in January and February of this year. A couple of news stories. The vaccine for kids 6 months to 4 years has been approved, has been distributed around town, and has started to be given. We're not seeing a tremendous amount of demand. After all, it is summertime and kids are looking to be at the beach or the pool and not at the doctor's office. We're hoping that as school nears, that more and more children will start to be vaccinated against COVID. The other news is about the variants. We always carefully follow the variants, and it looks like the BA4 and the BA5 variants are now spreading more both in the United States and in Oregon. And although we haven't detected them yet in Douglas County, probably in Douglas County, the BA4 and the BA5 are kind of cousins of Omicron. They're in that Omicron lineage, although they didn't come from the BA1, which was the Omicron. They seem to all develop at about the same time. And BA4 and BA5 are interesting because you can get infected even if you've been vaccinated, and you can get infected even if you had previous disease. So in this last week or two, we have started to see people with multiple cases of COVID. So they had it back maybe last spring, then they had it with Delta, then they had it with Omicron, and now they're getting it again. And so previous infection, while it does give you some protection against severe disease, it certainly doesn't give you protection against catching the disease. And some of these people who've been sick the second or third time say it was pretty bad each of the times. And so we still need to be cautious when we're in areas like closed spaces or crowded areas. And still our recommendation is that if you're sick, please stay home. Again, most of the cases that we see, people can trace it back to the person they got it from because they said, well, we went to dinner and they were a little sick. They thought it was just allergies. And they got COVID from them. We also got some questions over this week. One of the questions was about the CDC risk levels. And this has been an issue because Douglas County, Josephine, and Jackson counties are in the high range. And that then brings on new recommendations and new restrictions, such as wearing masks in schools and masks otherwise. This is really confusing. And it's confusing because this is a 2-part measure. So being the high range, you have to have both a high number of cases, that is over 200 cases per 100,000 per week, and a high number of people in hospital. So Douglas County just barely met the high range. We had about 13 people per 100,000 a day in the hospital. And if we had 12 per 100, and we had 12 a day, we wouldn't have been in that range. But our case rate is pretty low. For example, I'm this week in Deschutes County, and Deschutes County has more than twice as many cases as Douglas County and almost as many hospitalizations, but they're in the medium range. Well, it's a much younger population. And with a much younger population, you might expect them to have fewer hospitalizations because most of the hospitalizations are in seniors. So it's not clear looking at the data that really Deschutes County is any less risky than Douglas County. And because of this, it's been really just a mess. Now, this measure was put in place by the CDC back at the time of Delta. And you can remember at the time of Delta, our hospital was bursting at the seams. There were days when they were just at their limit, and if we had any more sick people, we would not have had places to care for them. And during that time, when the hospital is really full and there are a lot of cases, it certainly made sense to do extra precautions. But now, when there's 2 people in the hospital on oxygen, it's a little hard to say that this is a crisis, and we need to move to those new standards. But nonetheless, if you feel you're at high risk, please wear a mask. Please consider avoiding crowded areas. Please consider postponing indoor activities that might be at high risk. But again, we've tried from the beginning not to tell people what to do, but to tell them of the situation and to let them make the decisions for themselves. So COVID is still there. I think it's been pretty stable over the last month. And so we're continuing to work on it. But I do not think we've seen the end of COVID. I do think we'll probably have another BA4, BA5 spike, probably sometime later in the summer or early fall. And then who knows what's happening in the early fall. The FDA is considering approving a vaccine that would have snippets from both the original virus and from the Omicron strain so that you would get protection against both. And that certainly could help if it looks like Omicron is going to be the strain that's going to get us this winter. However, as we've seen, new strains develop very quickly and they spread very quickly. It takes about 6 to 9 months to make a new vaccine. And so it's not clear that we can stay ahead of the new variants that develop. So that's where we're at with COVID. Today we're here with Laura Turpin, who's our chief epidemiologist, an incredibly talented young woman who has really done a tremendous amount of work during the COVID phase. In addition to working with COVID, she's also working with syphilis. So syphilis is something that we don't think much about. So syphilis is a sexually transmitted infection. I remember when I was in medical school, there was some syphilis, but we didn't see very much of it. And in fact, by about 2002, 2003, syphilis was nearly gone. But over the last 15 years, that has clearly been a different story. So Laura, tell us what's happened with syphilis over these last 15 years.
So syphilis was decreasing previously, but in the past 15 years, we've seen an increase. So locally here, we've put some measures into place to try to decrease our case rates.
And so syphilis is a disease usually transmitted sexually. But the biggest concern we have, and as a pediatrician, my biggest concern is that a mom has syphilis, gets it during the pregnancy, doesn't get found out, and then the baby winds up with syphilis and gets what we call congenital syphilis.
Right. Congenital syphilis has a lot of bad outcomes for the infant.
So I've been doing pediatrics for over 40 years, and I had never seen a case of congenital syphilis until this last year. And now Oregon has had 20 in this last year. So really, really awful. So tell us a little bit more about what the DPHN is doing to help deal with this.
So the first thing that we're doing, and part of the reason why we're on COVID Conversations, is just increasing public awareness of what syphilis is, making it so that it's something people are talking about, increasing awareness of syphilis to providers. A lot of providers, especially the younger ones, have never seen syphilis in its many presentations. We're providing Visalin, which is the medication used to treat syphilis, to smaller clinics, as previously the cost of the medication was a barrier. It was it was expensive to have on hand, and we want providers to have it on hand, ready to treat patients. But before this, the cost had been a barrier there. So DPHN is providing that to clinics and locations where people might test positive. We hired this year 2 new disease intervention specialists, which are staff members that reach out to SP cases and provide information to them about where they can get treatment and where their contacts can get tested and treated as well. So those are some. We're doing a whole lot, but those are some of the things that we've been doing lately.
Well, the Bicillin is really an interesting story. Bicillin is a form of injectable penicillin, which has been around for at least 40 years. And it used to be very inexpensive and used to treat syphilis, but also used to treat like strep throat. And so that anybody can remember when they were a kid and got sick and got a shot of antibiotics, it was most likely Bicillin. Bicillin used to be cheap, $5 a shot, $5 a shot. And over the last few years, although it's exactly the same medicine, it's now $500 a shot. And because of that, it was hard for people without insurance to get it. And because it comes in tens, it was hard for clinics to spend $5,000 for medicine that they may or may not use. So the plan is that the state gets this at a low rate, sends it to us, and then we're going to send it out to clinics so that the lack of Bicillin should never be a reason that people don't get treated. So, Laura, you talk about the many phases of syphilis, and it's very detailed, but what are the different kinds of symptoms that people have that they should think about?
The first sign of syphilis and primary syphilis is having a chancre, which is usually a painless sore. It can be found in the mouth, it can be found in the genital area, that resolves on its own. So it's a bump because it's painless and because it goes away after a few months. Some people don't ever seek care, they don't know what it is, and they won't get identified at that stage. Secondary stage of syphilis has symptoms including a generalized body rash, a rash especially on the palms of your hands and on your feet is a sign of syphilis, hair loss, alopecia of the eyebrows or on the head. What am I missing, Dr. Bob?
So you can get eye findings, you can get kidney findings. There's so many different things. In the old days, syphilis was the great pretender, so it could really cause almost any kind of symptom. So what we're helping for people to do is that if they do have this painless sore on their genitals, and certainly if they've been around with somebody else with syphilis, that they get treated right away, because if you get treated in that early stage, it's cured. And our concern, however, is that people don't get treated at that early stage, and it goes on to affect the other organs in the body. So what are we doing for pregnant women so that we can be sure that their babies are safe?
Well, we encourage women to, when they know they're pregnant, to seek prenatal care early. And we're partnering with some of our local women's health, reproductive health partners, and making sure that they test all pregnant women, sometimes multiple times in pregnancy, doing that screening to ensure that if they are positive, they get treated quickly so that there's no adverse effects to the infant.
And what are we? So let's say somebody's got this disease and they get treated. How are we dealing with them? So that they obviously got it from somebody else, to figure out who they either may have gotten it from or who they may have given it to.
Sure. So myself or Paul or Andrew, when we talk to patients, we give them the option. If they choose to notify partners themselves, that's great. We help them with resources that they can give to their contacts. If they would prefer to remain anonymous or would rather have us do it so that we can answer any questions their contacts might have, we do not notify contacts as well. So we reach out and call people and notify them that they've been exposed and help them get testing and treatment as well.
Oh, great. Well, thank you for all the work you've done on this. I know it's a big problem, and so it continues to rise. But we would really like to get that done. So thank you for all you've done for that, and for all you've done for COVID. And if anybody out there has questions, please send them to us at facebookquestions@douglaspublichealthnetwork.org. Again, this is Dr. Bob Danhoff, the Public Health Officer of Douglas County. Thank you, and we'll see you again next week.